Good evening. Thank you so much for joining the Interfaith Works community conversation. And we have gathered a very esteemed group to help us think about this big question, the vaccines and the vulnerable. Interfaith Works, you know, has been serving our community that has been the poor, low income, the marginalized, homeless for decades. And we would naturally have a concern about the impact of COVID-19 on the people we serve, and particularly about how they will get vaccinated because they are a very vulnerable population. And so tonight we are pleased to welcome as our speakers Dr. Kathryn Kelly with Kelly Collaborative Medicine, and she has been providing care to many of the homeless in our shelters. We also are pleased to welcome Shawn Ellis, and you'll see their bios on the screen. He is handling the COVID Outreach Committee from the Office of Community Partnerships for the county. And then Elijah Wheeler, who works for the Montgomery County Collaboration, for Children, Youth, and Families. And he is the new chair of the African American Advisory Group, which is an advisory group to the county executive. So welcome, welcome, welcome. We are so pleased that you have joined us because we know that tonight is a very busy evening and we appreciate your setting your schedule to join us. We are going to move right away to Dr. Kelly to give us a sense of what we know right now about COVID-19. And also she's going to tell us a little bit about the homeless population that she has been working with and treating for the county. Dr. Kelly.
Hello, everybody.
Please begin. Thank you.
I'll try to keep it brief, and then of course, if you have questions that you'd like to ask at the end. I'm not sure if any of you had the opportunity to sit in on my presentation or the presentation of one of my nurses on COVID-19 and the vaccination in general. I think in Montgomery County, we've done a good job of testing, and especially in our homeless population, we test frequently, if not every week. Some places do it more than once a week just to try to decrease the outbreaks in those areas. And a big part of what we were doing over the last few weeks is to educate the staff and the clients about what COVID-19 is, what the scope of it has been, and to really answer some questions about the vaccination. So the biggest questions that we get about the vaccinations are they safe? There's two that are out right now. One is Pfizer. So the Pfizer vaccine is a messenger RNA vaccine, and I can actually send the PowerPoint to you all if you want to review it. That has kind of goes a little bit more in depth about this. It has 5 ingredients, just like the Moderna, which we'll talk about. The other one is Moderna. Moderna is also a messenger RNA vaccine. Pfizer has to be kept very, very cold. So a lot of people who get the Pfizer are getting them from these big hospitals or big healthcare systems, and it has to be given 3 weeks apart. The second one, the Moderna, has to be given 4 weeks apart. It doesn't have to be kept as cold. So especially like in my practice, we've been approved to get it and to distribute it, but we don't have to have the ultra freezers or the financial.
I believe Dr. Kelly got kicked off somehow. Yeah.
Well, Dr. Kelly, we will look forward to you trying to join us again. And this is always the challenges with our Zooms. You never know who will decide to join and present a little distraction there. Well, Dr. Kelly, we'll circle back to Dr. Kelly whenever she returns, but we appreciate what she was sharing with us. So what I'll do is just move now to Shawn Ellis. And I think that moving to Shawn will be most appropriate right now, because I know that Shawn has another commitment, and we really appreciate him stepping away from the county's town hall tonight on this very same topic. So Shawn, would you now make your presentation?
Absolutely. I'd like to begin by thanking you for inviting me. And to introduce myself, my name is Shawn Ellis. I work out of Montgomery County's Office of Community Partnerships. I actually spent the last 18 months managing the county's 2020 census campaign. Because of our relative success with that campaign, our office was asked at a relatively early point to join into the efforts to ensure that as many people in the county got the COVID vaccination. So what I wanted to talk to you about tonight, not so much the process of vaccination in the county, although we'll share some information about that. I want to talk to you about what we're doing to try to ensure we get to some of our vulnerable communities, some of our historically underserved communities, and what that outreach effort looks like from our perspective. So many of you may know that we formed what we called a complete count committee in the spring of 2019, with the goal of formulating most of our strategy around outreach and messaging within that committee. That committee was made up of about 140 members of the faith community, from nonprofit organizations, from civic associations, from the business community, and government agencies. The reason why that number 140 is relatively significant is that these complete count committees were essentially established in just about every jurisdiction across the country. And the average size of the complete count committee in most places was between 15 and 20 people. So in comparison, the 140 that we invited to join ours is relatively large. And the reason why we did that is Montgomery County is very diverse. And we felt like there was a need to ensure that we were reaching into all the communities in Montgomery County. So we really took this all hands on deck approach to developing the outreach and the messaging around the census outreach. So out of that, we created 5 subcommittees. There were regional subcommittees based around the existing 5 regional service centers. And those subcommittees were chaired by the 5 regional service center directors. And then what we did is have community liaisons out of the Office of Community Partnerships serve as co-chairs on those committees. The reason we took this regional approach is we felt like it made sense that the folks who lived, worked, had established relationships in these communities were the folks who should be delivering the messaging. They should serve as the trusted voices, and there's no one better positioned to develop outreach strategies for those communities than folks who actually know what the community looks like. So if we're trying to do outreach in Long Branch, it just makes sense to have someone who has a relationship in Long Branch, whether it's from the faith community or community organization that's serving the Long Branch community or lives in Tacoma Park, to be a part of that process. So that's why we took that approach. So what we've done now, taking a step back, is reformed or brought together that group, that complete count committee, and transitioned it into what we're calling the COVID Community Committee. We're trying to keep the CCC in place. And we've also decided to build it on top of the Regional Service Center this time around as well. So we have one for Up County, one for Mid County, we have one for Silver Spring, for East County, and for the Bethesda Chevy Chase region. This is important because everything we do when it comes to outreach now, really and truly the strategy that we develop is going to come out of these subcommittees. So a perfect example is we know that, for example, Lincoln Park in Rockville is a historically Black community. And we know that the Black community is one of those communities disproportionately affected by COVID. So it's really important to us that these are communities that are getting registered or pre-registered for the vaccine. So we partnered with Mount Calvary Baptist Church to host a pre-registration event actually it is March the 6th between 1 and 4 o'clock p.m. to invite residents from that community or surrounding communities to come over. And if you're 75 or over, and actually at this point, we're actually inviting folks who are just over 65 So potentially come and get support. We'll help you pre-register on site. If you don't feel comfortable coming on site to get pre-registered, we'll have a number that you can call so you can get pre-registered that way. But really and truly, the effort now is to get as many folks as we can pre-registered for the vaccine as possible. One of the realities that we need to keep in mind is that in order to get registered or get a vaccination in Montgomery County, you have to be pre-registered because that's the only way that we're given up appointments in Montgomery County. So that's really the process by which we're looking to do our outreach here in Montgomery County. We're partnering with community organizations, potentially from across the county, from within our faith communities up and down Montgomery County, to really not only tell us where we need to be, whether it's, for example, a food distribution event that's hosted on a weekend or on a weekday evening, to a faith community event that's existing on calendar, so that we can get as many folks the support to pre-register as possible. The other thing that we are really focused on is messaging. We know there are two things that contribute to communities or folks not taking the vaccine or pre-registering for the vaccine. We know that one of them is just access, whether it's an impediment, technological impediment, or it may have something to do with their limited English proficiency. But the other piece of it is hesitancy. So what we're trying to do is ensure that we're providing trusted information about the vaccine, the ways that folks can go about securing a vaccine, and the resources they have in order to get to the vaccination site if that's necessary. So we're focused on providing good, solid information to communities. And then for those folks who have some hesitancy, trying to address those needs or those concerns as they exist. So if I back up for a second, I want to talk really briefly about the communities that we're really looking to conduct outreach with, because it'll give you an idea of why it's so important to us here in the county. All right, so if you look at this slide here, it gives you an idea of where we are in this moment. So we've served, or we've gotten 127,000 residents, or just over that, vaccinated for their first shot here in Montgomery County. And then approximately, well, not approximately, but 58,000 or 50,000 folks, or just above that, have received their second dose. That's significant because what we hear in the media sometimes, right, in this moment, is that the process has been slow, and to some extent it has been, but if we look at where we are in Montgomery County compared to the other districts or jurisdictions in the state, we're not doing poorly at all. What is important to keep in mind as far as this is concerned is here in Montgomery County, we receive about 15,000 doses a week. And of that 15,000 doses, the county only controls about a third of that. So between 4,500 to 5,000 doses a week are controlled by the county's public health department. The rest go to pharmacies, hospitals, and directly to those serving long-term senior facilities. So when we think about the number of folks that we're looking to get vaccinated in this moment, and the reality that we are getting between 4,500 to 5,000 doses a week, it's going to be a process that takes some time. So part of what we need to also do is manage expectations as far as the doses are concerned. The thing that's also important to understand is, well, who is actually pre-registering to get these vaccinations? So if you look at this screen here, you'll see it'll give you an idea of those populations who have registered to get or pre-registered to get their vaccine. And the green denotes areas where you have high registration, and in some cases, numbers of folks that exceed the actual existence of the population. And then in the orange and in dark red are those folks, or those census tracts actually that are under-registered. And it just so happens that many of those census tracts that you see in the red also correlate, or I should say, correspond to those hot spots where we know communities are hit really, really hard by this virus. What you also need to figure out or understand is how this affects, or what this looks like in terms of the population breakdown. So right now we are focused on 75 and older, and we know what the population in this county looks like for those who are 75 years and older. So about 8% of the population is Latino or Hispanic, 12% African American or Black, 14% is made up of Asian or Pacific Islanders, and 64% is white. Unfortunately, when we look at the rate of COVID cases and we look at the rate of pre-registration, it's not where it needs to be, right? Especially for those folks at 75, the age of 75 and up. So what we need, for example, in this moment, there's a lot of work that needs to be done to do outreach to the Latino and Hispanic community and the Black or African American community, because we see, according to this chart, that they're disproportionately affected by this disease, and they're not registering at the rate that we need them to in order for us to impact how this is affecting these communities. So that's the work we're doing. Our work isn't just to get everyone vaccinated, and that is what we do, or what we're looking to do, but our focus in this moment is how are we going to message those communities that are historically underserved, and for the purpose of the census, undercounted, how are we going to ensure they have access to this vaccination? And we're getting information about what the process looks like. The only thing I'll share with you now beyond that, because I don't want to take up too much more time, is how we're looking to going about getting folks vaccinated. Simply said, there's a website that everyone should visit, and we ask that if your organization is able to facilitate or help a senior register, that is lovely. That's what we ask you to do. But you can also help your neighbor, your aunt, uncle, grandmother, anyone you know that fits into this category who is eligible to get a vaccine or get vaccinated, to help them however you can with the pre-registration process, because everyone's not going to feel comfortable or be able to do it. And for those folks who need assistance and not able to attend one of the many outreach opportunities that we're going to stand up over the next weeks and months, there's a number that folks can call, and that's 240-777-2982 to get assistance with pre-registration. The last thing I'd say is, if you know someone who's interested in joining us and being a volunteer, whether it's in-person outreach or potentially virtual outreach to help the senior, or as we start to cast this broader net to more folks across the county, have them visit Montgomery County's Volunteer Center. They can just type in montgomeryserves.com and it'll take you to the Volunteer Center. There are 2 opportunities that are posted now, but we will have some specific opportunities for folks to join and get involved in down the road. Just keep in mind, there will be some training and orientation necessary to participate depending on where you decide to jump in and help this effort. Beyond that, I will set aside everything else for questions down the road. And thank you.
Thank you, Shawn. I know that you have to leave. So if someone has a burning question for Shawn, we would love for you to put it in the chat box so that we will be able to give an opportunity to ask respond to a question before he has to leave. I did see that someone asked about Mr. Elwidge, our county executive, in our chat box. Well, no, the county executive is not here tonight, but we have a number of great guests here who are speaking. Shawn Ellis is one from the County Outreach Committee, and Dr. Kelly, who was on our virtual and then had to leave and now is back and with able to join us again. And then we will be concluding with one other speaker, Elijah Wheeler. But if you have a question that's sort of a medical question, we certainly can get that asked and answered by Dr. Kelly as far as she is able to do so. If someone has a question for Shawn regarding the outreach, please let us know.
That's not related to outreach, but I can answer it.
All right.
Do pharmacies have different rules for giving vaccines? Or the state kind of guidelines? Yeah, so what everyone should understand, and part of what we are tasked to do, is provide a basic understanding of what the system looks like. the guidelines are different for the pharmacies and for the hospitals. What county is doing is taking an approach that really takes into consideration equity. And because of that, we are prioritizing zip codes that are disproportionately affected by this disease. That's not happening with the pharmacies, it's not happening with the hospitals, and it's not necessarily happening with the state sites, although as of yesterday, they're attempting to add some equity into their framework. So what's happening across the state is not going to be the same as what happens here in Montgomery County. As a matter of fact, one of the reasons why you see us at different priority levels or in different phases is because you have smaller jurisdictions in the state that are breezing through this distribution process, which is great and it's awesome. But if you have a couple 100,000 residents compared to the 1.3 million people who live in Montgomery County, state, it's going to look slightly different in terms of how far along in getting folks these vaccines we are. So it's important to keep in mind because the state is going to announce this with those acknowledging those counties that may be in 1C as opposed to where we are. So that's just important to know.
Thank you. Shawn, we know that you may have to leave, so it is all right if you do have to go at this time, but thank you so much. And would you put in the chat box the number again so that anyone who might have missed jotting it down when your PowerPoint was up, they'll know it, be able to see it later. Thank you, Shawn Ellis. Dr. Kelly is back, and we will want to continue where you left off, Dr. Kelly.
Sorry about that. It kicked me out and then I couldn't get back in. So I came on from my phone. It worked from going there. So
Sorry about that. Technology will do those kinds of things.
No problem. Well, we were talking just, like I said, I'll try to keep it brief. And what I'll do is I'll send you this PowerPoint that you all can take a look at. But we just talked about there's 2 current vaccines that are approved for emergency use, the Pfizer and Moderna. And they're both messenger RNA vaccines. They have very few ingredients in them. They have a lipid protein that has the actual message in it. And then they have table sugar and some salts that help to stabilize the molecule. But there's no latex, no preservatives, and no egg products in the vaccine. So I'm going to ask these questions that people usually ask and give you the answer. And I think these may cover some of the questions you may have. So the first one is, do I have to wear a mask when I receive the vaccine? And the answer is yes. The CDC recommends that during the pandemic that we wear a mask in general, and especially when we go into these places to get our vaccines. So when you're in a healthcare facility and when you're receiving your vaccine, including the COVID-19, you should always wear a mask. And the newest recommendations have actually been to wear a double mask. The second one is, who is paying for the vaccine? So vaccine doses purchased with US tax dollars, and there should be no cost. However, there may be a cost associated with the actual administration, but there are ways that that will be also relieved so that personally, each person should not have to pay for the vaccine. And with the homeless, that's a big question for them. Is there a cost related to getting this vaccine? And it should also be noted, and I think somebody may have spoken this a little bit, when it comes to our homeless population, the mortality among the homeless when it comes to COVID-19 is greater than the general population. And some of that is because many of those people fit into the groups that Mr. Ellis was talking about. So Hispanic, African American, immigrants who may be here and undocumented, I shouldn't say undocumented, individuals who are here who don't have health insurance. And they also may not speak the language, and they may not feel comfortable going into certain spaces to seek medical care, or they may not have access. The next question I often get is, if I already had COVID and recovered, do I still need to get vaccinated? And the answer is yes. So the latest recommendations say that if you've been infected, you can have some natural immunity that may last for about 90 days. So it's uncommon for you to get reinfected within that 90-day period. You should not go and actively get a vaccine while you're sick. You should continue to quarantine. But once you've finished your quarantine and you're stable, you may get vaccinated. Do I need to wear a mask and avoid close contacts with others if I've received the second dose of the vaccine? So like I said, both of the current vaccines require 2 doses, and the answer is yes. So in order for us to build the antibodies that we need from the vaccine, we have to wait about 2 weeks. So you get the first vaccine, 2 weeks later, you're going to get about 50% of the immunity that you're going to get from it. You get the second vaccine, and 2 weeks after that, you'll have the full immunity that you're going to get. The efficacy of the vaccinations, which means how effective they are in preventing the virus, is about 94 to 95%. So there's still a 5 to 6% chance of getting the virus. And I try to compare this to the flu. So a lot of people have questions about the flu vaccine as well. The last year that they were taking, looking into it, 2019 to 2020, we lost about 34,000 people to flu. And of those, 95% had not been vaccinated. So a huge, you still may get the flu, but you won't die from the flu. And we're hoping that that's the same efficacy and the same outcomes that we see with the COVID vaccine. When can I stop wearing a mask? The answer to that one is we don't know. There's just not enough data yet. As we keep moving forward and we get further into the vaccines, and some of the studies come out looking at how we've done with vaccinations and immunity, will be able to give a clearer picture of that. But I think some of the things that won't change will be that we want to encourage people to stay home if they're sick, and to isolate, to not go out into places if you have symptoms, to continue to wash your hands, continue to social distance. Does immunity after getting the COVID-19 itself lasts longer than the protection from the vaccines? And the answer to that is we don't know. It's going to be important for us to get both natural immunity and vaccine-induced immunity in order to be able to combat the pandemic. What percentage of the population needs to be vaccinated in order to have herd immunity? So I think we've heard the term herd immunity quite a bit. And herd immunity is a term used to describe when enough people have protection, either from previous infection or vaccination, that is unlikely a virus or bacteria can spread and cause disease. And we just don't know how much that is. Dr. Fauci thinks it's probably between 70 and 85% that need to be vaccinated. And part of it is that we also want to make sure that those vulnerable populations are the ones that are getting vaccinated. And as Mr. Ellis spoke on just a few minutes ago, those are not the people that are registering. So part of what I'm doing in my clinic and with this talk with our homeless population is giving them that trusted information and allowing them to make a decision on getting vaccinated. And then the last one is how do I report if there's an adverse event from the vaccine? And they do have multiple places that you can report those. One is the Vaccine Adverse Event Reporting System. And the second one is an app called VSafe. And when you go and get vaccinated, they're going to give you a paper that actually shows you how to get onto VSafe to be able to report any issues with the vaccine. So I will stop there. And like I said, I'll send you all, there's a lot more stuff in the slides that you can look at from a medical standpoint, but I'm happy to answer any questions if I can.
Well, I see there are a number of questions in the chat box, and I think that Matt McGinnity, who is our communications manager, is going to try to have those answered, I guess, by either Shawn or Dr. Kelly.
Yep. So far, it's these rolled in while you were speaking, Shawn. How can an organization hosting food distributions find out about helping get people pre-registered?
Great question. So there's a few ways that we would ask to go about that. We'd love to build you into one of the regional subcommittees. If you, for example, are more active in Gaithersburg or Germantown, we could connect you with the Up-County Regional Subcommittee. And I can post the email address that you can use to contact me so I can connect you with Kathy Matthews of the Up-County Regional Service Center. The other way is we're looking to get as much information as possible and events and opportunities to do outreach as possible. So you can email me directly, shawn.ellis@montgomerycountymd.gov, and we can coordinate that.
This one is coming from Reverend Diana. I'm sorry, I may mess up the name. Winger Ryo Hughes of UMC Mid-County Hub. They say that our hub has volunteers and space to support the reach out process. We serve a vast majority of Asian and Hispanic senior community. Can we use our space as a vaccine facility?
That's a great question. So identifying locations for potential vaccine facilities down the road is something that will happen through HHS with some input from our regional service center directors. But what I'd say is reach out to your regional service center director, or I'm sure you're in contact with them, and suggest that that's a place you think should be on the list of potential sites.
Awesome. Two more so far for you, Shawn. When you are registering people, are you asking if they have transportation?
That's a great question. So that's a question we get most often now. It's on the registration, the pre-registration form. But what has become clear over the last 3 or 4 days as we meet with community partners is that it's not clear, or we haven't done a great job of communicating what the options are. So it's something that's asked, and the idea is once you're contacted to make your appointment, they should be asking you if you need support for transportation services. But we also know that there are volunteer services or services available for those folks who need help or need support in getting from home to the vaccination site and back to their home. So we're going to work on doing a better job of making that information available, because it's something that is available.
Awesome. And the last one in the chat box right now is, are Hispanic and other people like influencers that are Hispanic and other people of color speaking about the need to get vaccines or the vaccinations?
Well, I think Elijah can probably talk this in a little bit, but that's the game plan. The reality is, for me, it's kind of my pet peeve. So in the county, we can develop all this messaging and all this, let's call it messaging to these communities, but there's no one better positioned to talk to the Amharic speaking community than someone who is an Amharic speaker. So they should help us develop that messaging. They should help us, do a TikTok video or Instagram post, because while I'm informed and hopefully I have a very trustworthy face, a stranger's not going to believe me the same way they might believe someone that they have an existing relationship with or see as a trusted voice for their community.
Awesome.
And I'll just add to that just real quick. I'm sorry. Yeah.
No, go ahead.
Is the Medical Society for Montgomery County. We had a meeting with the comptroller a few days ago and talked to him about those same kind of concerns, because we do see that people will go to their physicians as a trusted voice. So I know it's, some of those people may not have a physician, which may be one of the reasons they don't go to those spaces. But a big part of what we're trying to do from the Medical Society is to make it so that we can give those vaccines, because people will come and see us, especially those physicians of color, those physicians that are connected to those communities to get those vaccines. So that is a part of what we're working on from a medical, the Montgomery County Medical Society, and working with the state to push that forward.
Awesome. Those are the questions in the chat so far. Actually, a couple popped up. Oh no, this is from you, Shawn. Sorry. Thank you Shawn has provided the registration link and also the phone number as well. So thank you, Shawn. I appreciate that.
Thank you. Well, we'll move now to our last speaker, and he is the new chair of the African American Advisory Group. And he is going to tell us a little bit about that advisory group and its role that it might be playing right now in bringing concerns from the African American community and other communities of color, perhaps, to the county executive. So Elijah, would you like to start by letting us know a little bit more about this advisory committee?
Sure. Good to be here with you this evening, Reverend Robinson and others from Interfaith Works. So to speak to the purpose of the African American Advisory Group to the county executive, it's been in existence for a number of years, and the purpose is to ensure that the county executive is well informed of and able to essentially act effectively in response to the needs and concerns of the African American or Black population here in Montgomery County. Typically, the advisory groups, there are many here in Montgomery County, are staffed by members of the Office of Community Partnerships. I believe I saw Julian Norman who was on the call with us a little bit earlier, who's the staff person specifically, who serves as the African American liaison to the county executive, but he serves as the staffer for our group. But, you know, in a nutshell, the whole point of the group is to advise the county executive on the needs and concerns of African Americans living here in Montgomery County, including but not limited to advice regarding policy initiatives, budget priorities, you know, economic and other partnership opportunities, and then the implementation of programs here locally.
Well, I should say, of course, that I'm on the committee, and thank you, Chair, for the work that you're going to be doing with the committee. So what are you hearing from the African American community about their concerns about the vaccinations?
So I, like many others, and it's been spoken to a little bit earlier today during the course of this call, I'm hearing concerns that are binary in a sense. On one hand, I've heard concerns about the vaccine itself and people's relative skepticism around the vaccine and its speed to market and how quickly it was developed, and some fears around that. On the other hand, I've heard concerns about the lack of access to information around how and when to get vaccinated. I think both of these things are related to the fact that there has been a terrible job done of public messaging from the start about the virus itself at the federal level, at the national level, and then the process to reduce its spread. That messaging, I think, has been just to be completely honest, an abject failure that lays at the feet of certainly our former administration at the national level. So I want to make sure that it's clear that I'm not blaming Montgomery County government for that failure in messaging. But that approach has been almost colonial in a way, that the carrying out of the information sharing that's taken place with testing and then vaccination has been done without a clear sense of cohesive messaging that takes into account culturally based and contextual issues based on prior history with Black people specifically, in this case, their interaction with our medical care industry. Once again, speaking to a comment that was just made a few minutes ago, it's really clear that we need trusted messengers who look like the community that we're trying to serve to make sure that people are getting the information they need.
So have you had an opportunity to raise some concerns that the group has with the county executive in your advisory role?
Sure, I have. I've talked to our CE about these concerns, and I know he hears them regularly. I know he's keenly aware of the issues that have historically faced our community, and is doing all that he can, along with county council and folks like Dr. Travis Gales, our health officer here, Dr. Raymond Crowell, the head of Health and Human Services here as well too. They've been working from dawn to dusk to help folks. But what we've run into at this point is an issue that's much larger than Montgomery County. Certainly, Shawn spoke to it earlier, even the messaging around the number of doses that we get here, and the fact that Montgomery County itself is only in charge of 1/3 roughly of those doses that we're getting. So there's a lot of misinformation from that aspect. So I think every day what's happening, our local officials, our county executive included, are really trying to mitigate some of those issues that are happening at the federal and then state level to try to make sure that our county residents are receiving the information that they need.
I'll have one more question for you, and it relates to something that I had asked of Shawn when we were preparing to start the conversation tonight, and about the county's goal for reaching 80% of the population, and so that's a big number. But for all the barriers that we know exist, the African American community, the Latino community, Hispanic community, we know that race and all those issues will play a part in the success. What do you think about the potential impact of all of this and being able to reach our community, especially our Black elders who have been saying that they're just waiting to get vaccinated, and other communities are getting vaccinated and they're younger than they are? It's making some people really concerned about the reality of actually reaching some of these goals, especially within the minority communities.
So, I would offer that, when you look at issues of, race and socioeconomic status, gender, age, some of these things, there has to be a recognition that there's a really powerful and complex relationship that exists between each of those issues. And so for anyone who lives at the intersections of those things is going to have a tough time navigating society in general, right? Because at the end of the day, they all add up to essentially an accumulated disadvantage when one is trying to break down and move past some of the barriers that have been put in place. So, you know, that's not unique to Montgomery County, right? We know that that's specific to America, if we're being honest. So when we start talking about, you know, race, ethnicity, sexual identity, age, disability, socioeconomic status, geographic location, all of these contribute to an individual's ability to essentially achieve good health. So it's definitely something that's impacting local residents here that I think the county and our officials are looking to overcome and try to mitigate. But ultimately, what we're talking about here in the case of COVID-19 and now the vaccination process is an unequitable income from, or it's not income, but an equitable outcome, excuse me, for many as a result of this.
I see there's a question in the chat box. And I think it's for any one of you to answer. Matt, would you just share it so that everyone will hear?
It's from Jill. Does anyone suggest to the elderly and essential workers to look outside Montgomery County? And are there other counties that are servicing, I guess, phase 1C?
So what I'd say is, I was actually typing out the message now, but I'll just address it. Anyone who is eligible to receive a vaccine, whether it's an essential worker or someone who's 75 plus, should certainly try to get the vaccination at one of the Maryland state sites, at one of the pharmacies, or at a hospital. What I will say is, while there was some confusion at the outset of, or when this process rolled out across the state, other jurisdictions in the state of Maryland, at least, are not taking residents who live in Maryland. I know there are workarounds that people have found for that, but officially they're not taking, they're not accepting appointments from folks who live outside of their jurisdictions. But if you can find an appointment at M&T Stadium, at any other state sites, then I encourage you to use those avenues, because other folks are. But understand that it's, at this point, it's a first come, first serve. And as was described to me in one of the conversations we've had this week, it kind of feels like the Hunger Games. And, you know, Montgomery County is the place where we're trying to avoid that. We're trying to make this as equitable as possible. And so it's not dependent on the time you have to devote to this, or your access to technology.
So it's looking inequitable, did you say?
So what I'm saying is, in Montgomery County, until recently, we were the only part of this equation that was trying to build equity into this equation.
Difficult. Well, this is a good point to, if anyone else wants to make another comment or has another question, but our CEO is going to sort of talk a little bit about, you know, the value of tonight in the work that IW is doing to advocate for all of the concerns that we have. And so he may want to be speaking now, and as we wrap up our evening, but I do see that there is another question.
Yep.
That I think it's for you, Shawn.
Is Vaccine Finders a volunteer position with you?
Vaccine Finders or Vaccine Hunters? I know Vaccine Hunters are an official, not official, but it's a group of folks, teachers who are helping to connect residents with appointments. Well, I can tell you this, for the county's volunteer initiatives that we're standing up, there will be space for folks who do just that. And then we'll have folks who are doing the in-person community outreach to both inform communities, but also get them pre-registered. So the Vaccine Hunters aren't part of our equation yet, although we've been working with them on specific projects.
Dr. Robinson, I actually have a question, if I can. It's to all of you guys. So so Johnson & Johnson is coming out with their own vaccine. but they're the dosage is different in terms of the amount. It's a one-time dose, but the efficacy is different. Is that vaccine being considered as part of the logistical plan for vaccinations, or is it way too early for that? Has that changed any of our plans logistically for giving out the vaccine in the county?
Maybe I'll let someone else deal with that. What I'll say is, from my perspective, that's slightly above my pay grade, and that's something that HHS is going to sort through.
Well, Dr. Kelly, you may be the person.
So, I mean, Johnson & Johnson hasn't been approved for emergency use as of yet that I've seen. I mean, I haven't been on the internet or doing things today, but I think it is something to consider. I think some people are much more comfortable, and we may have some better results when we only have to give one dose versus two. But it will come down to the efficacy. And then, part of this equation is whether what we see in the trials will actually play out in the real world. There was some information coming out of Israel that was saying that the Pfizer one is living up to the hype as far as the efficacy, but it is going to take some time. And I just wanted to briefly just touch on some of the concerns that I know that I see in the people that I see in the office with when it comes to how fast this was made. And, the technology behind the messenger RNA is not new. And we've known how to, make vaccines for a long time. Putting the two together is what's new. And, I think in the grand scheme of things, we want to try to avoid more deaths. I don't think any of us want to see another 500,000 people die. And I think part of what I've done with those people in my patient population, which are not just the homeless population, but in my private practice, African-American, Hispanic, Ethiopian, from all over the world, is really just talk about their concerns and listen to them, because they really have reasons behind why they're concerned. And I think if you go back to the Johnson & Johnson, having to do just one shot may be more comfortable for them, as that's what they're used to with a flu shot or with something else. So I think that Johnson & Johnson may open up a different avenue. But I think right now, as the other speakers have said, that it's about the equity and actually getting the vaccines here so that we can distribute them in the hands of people who can actually get them to those people at that level.
Thank you. All right. We have about 10 more minutes to talk before we officially conclude at 8 p.m. And so I want to give our CEO, Courtney Hall, the time now to speak and to raise any questions he might have of those who have joined us.
Thank you, Dr. Robinson. I appreciate everyone for joining. This has been a fantastic discussion. Each conversation around COVID that I've participated in, I've come away learning just a little bit more. And I think, frankly, that's really the purpose of having these kinds of discussions. Someone asked me the other day why our community conversations were different than some of the other conversations that have been happening around the community on this topic. And I said that I think really it's a much more intimate setting, right? So intimate, not necessarily meaning smaller, but intimate meaning that folks actually have a chance to ask questions, and you can most likely understand that before you leave, your questions will be answered. And I think that really is a common theme that we want to continue pushing in most of the marginalized communities that we're looking to have a disproportionate impact, positive impact on. A couple of things that I just observed from today. It really bothers me that a county as large as Montgomery County is only getting, I think, Shawn, you said about 2,500 doses a week.
The county in total is getting 15,000. Montgomery County Public Health only controls a third of that. So we get between 4,500 to 5,000.
5,000.
Yeah.
For the largest jurisdiction in the state, that I think is abominable. And there was a question that was asked in the chat earlier about the disparities between some of these private organizations, hospitals, pharmacies, et cetera, commercial pharmacies who are getting dosages, and the difference in access between them and the counties. And I've heard, and I'm sure some of you have as well, that some of those entities are farther along in the phases than the county is. And I don't think that's a fault of the county. I think that is really what this now is the actual disparity that we're seeing, right? It's being highlighted right now. And I think that is a shame. And I think that it's placing our communities, our most vulnerable communities at risk. I do want to thank Shawn, Elijah, Dr. Kelly for your participation this evening. Thank you, Dr. Robinson, for hosting this. I think this is a very useful conversation. I would hope that at minimum, those of you who have been on the call can carry away the message that vaccines work, right? Even when folks are afraid of the newness of the vaccine, one of the arguments I've been making lately is that any sort of Facebook side effect you've heard about what the vaccine will do to you is certainly much better than what we know has been happening for people who contract COVID. And so we're talking about life or death, really. I appreciate the fact that each of you, I think on the call, are committed to at least making sure that folks understand the vaccine. Whether or not you agree with the vaccine, at least you can understand the mechanics of the vaccine, understand how the messenger RNA works. I think that's really important for us to continue to spread that message. And then finally, I think the primary message that we want to make sure comes out of this meeting tonight is that there's a real need for equity, Something as simple as not having transportation to be able to get to the vaccine site, that's a real barrier. Not understanding how to log on to the county site and pre-register, right? That's a real barrier. And I appreciate everything you've said, particularly Shawn, about what the county is doing to try to approach this from a position of equity, because it's really, really necessary. As an organization, IW, obviously we are committed to equity. And one of the things we're really focused on this year is our advocacy agenda. And much of the feedback that you all have given us this evening is really helpful for us and is going to help us to make sure that our vaccine agenda is as robust as possible and that we're advocating for the right things and certainly the things that are needed in the community. And so I really do want to say to each of you, thank you. I appreciate your participation tonight. And I certainly am hoping that each of you have come away with some message that's been helpful. So turn it back over to you.
Thank you. Thank you. I just wanted to make sure that since we just have a few more minutes, to make sure that as our Courtney said, we have an intimate setting. So if there is a question or a concern that you have, we certainly are open to hearing it, and you can put it right in the chat. And if it is not able to be addressed tonight, we'll have that and be able to get back to you with an answer. So did we cover all of them, Matt?
We have one more that came in. Someone wants to clarify. So is it true that hospitals and pharmacies are private and separate from the vaccine numbers of Montgomery County?
So in terms of when you're counting how many folks in the county are vaccinated and in the state, that is added. But what needs to be made clear is Montgomery County government has no control over how those vaccines are distributed by the pharmacies or the hospitals. Like no control. So as I said, for Montgomery County, we are focused on 75 plus in this moment, and trying to build equity into that equation and focus on these communities and these geographic zip codes where we know these folks have been affected. it is not that way for the pharmacies or the hospitals. So, you know, that's just the reality at this point. As I was going to say earlier, I would advise anyone to use all of the avenues available to them to get a vaccine within the legal limits. But, you know, if the reason why the county is going the way it is that you shouldn't have to be racing to get an appointment. If your name comes up on the list, you should be able to calmly pick a time and a date that fits into your schedule and expect that when you get there, there'll be a vaccine waiting for you. And that's not the reality in these other places. So, you know, it's going to take us some time, but it's important, as far as I'm concerned, to communicate why it is taking us a little bit of time, and how what the county is doing is significantly different than what you're seeing in other places.
Thank you so much. You know, I see a comment in the chat box, and well, it's thanking us and saying, let's all collaborate and be part of the solution for this community. And it is important. When Courtney was mentioning about some of the advocacy that we're doing, our advocacy committee met, and there are a number of things that came forward that we could possibly advocating for, making sure that, you know, there are enough doses, you know, because one of the things we don't want people to finally get an appointment and then they arrive and then there's not enough, because we've heard of those kinds of things, or, you know, problems with appointments. And this whole issue of mass vaccination sites that are happening other places, but not in Montgomery County. And I know, Courtney, you mentioned this, we're the largest county in the state, and we're, you know, we have not been selected. And I know that there are other sites opening up. And so that's a concern that we could possibly trying to make sure that there's some advocacy on. And I just also wanted to mention, especially when we talk about the 75 plus, which we know the county is concentrating on, we do with our homeless population. There are people who have had to, you know, have to seek shelter, and they're 75 plus, they're elders. And we certainly are concerned that they, first of all, have to be in that kind of environment, but we certainly would want them to be vaccinated. So there's a concern about making sure that they are on that priority list to receive those vaccinations. And if there's anything else that someone might believe that Interfaith Works should consider adding to its advocacy agenda, please let us know. We are planning to have a part 2 of this conversation about the vaccine and the vulnerable, because we'll be watching it, and we know that this is a very fluid situation and things could change. And so when we meet next time on the last Thursday in March, we do hope that you will join us again, and please feel free to share the community conversations that Interfaith Works has been sponsoring since the pandemic began. Last April was when we started it. So thank you so much for your attention and for the time you've taken to join us this evening. And thanks, Shawn, you chose us over your job.
I'm getting in trouble.
But don't go back and tell
trouble.
anybody that it's my fault. Don't, yeah.
I'm gonna get, I won't
Yeah, I want you to
snitch,
keep your
but I'm gonna
job
get in
there,
trouble.
okay? Have a good evening, everyone. Thank you so much for joining us. Bye-bye.
Good night.